Good day. Welcome to the Adult Immunization online lecture series on typhoid as a vaccine-preventable disease, Philippine Guidelines on Periodic Health Examination Recommendations on Adult Immunization 2022. The CPG was developed to serve as a guide for healthcare workers when choosing cost-effective, evidence-based interventions for typhoid vaccine. Evidence summaries are based on the best available scientific evidence at the time of the formulation of the guidelines. It followed the widely accepted GRADE approach and the evidence to detection framework criteria. And recommendations shall hold and will be updated after 3 years or when new evidence becomes available. Basis for assessing the quality of evidence using the GRADE approach is shown in this slide. Typhoid fever, also known as enteric fever, is a disease caused by Salmonella enterica serotypes Typhi, Paratyphi, A, B, and C. It is transmitted through fecal-oral route. Globally, typhoid fever is estimated at 26 million cases, while paratyphoid fever is estimated at 5 million cases, causing 215,000 deaths each year. With over 100,000 deaths in 2019, almost 53,000 are from the Philippines alone. There is a 10 to 30% case fatality ratio if typhoid is left untreated and less than 1% if treated. Typhoid is endemic in many Southeast Asian countries, which includes the Philippines. Typhoid vaccine is indicated for prevention of disease, and the population at risk who benefits from the vaccine would be the travelers, especially those coming from endemic areas, persons with exposure to positive cases, and healthcare workers or microbiologists with exposure to the etiologic agent. Available vaccines include the oral Ty21A live attenuated vaccine and the intramuscular V polysaccharide vaccine, and the two new vaccines, the VREPEA or Vi polysaccharide vaccine bound to the recombinant exoprotein A of Pseudomonas aeruginosa, and the VTT tetanus toxoid conjugate vaccine, which are both being studied for their efficacy in children and adults. Live attenuated oral and conjugate parenteral typhoid vaccines showed significant benefit in reducing laboratory-confirmed typhoid fever in patients living in or traveling to endemic areas. There was no increased risk for mortality, hospitalizations, and mild to severe adverse effects. V polysaccharide vaccine significantly reduced the 3-year cumulative incidence, first-year post-vaccination incidence, second-year post-vaccination incidence, and third-year post-vaccination incidence of laboratory-confirmed typhoid fever, hence favoring the vaccine compared to placebo. Comparing the Ty21A live attenuated versus placebo, the Ty21A live attenuated vaccine significantly reduced the 3-year cumulative incidence, first-year incidence, second-year incidence, and third-year incidence of laboratory-confirmed typhoid fever compared to placebo, hence favoring the vaccine. No severe adverse effects were observed for the V polysaccharide. V polysaccharide vaccination was associated with swelling. In contrast, the risk for fever and erythema were equivalent between the V polysaccharide and the placebo arm. Ty21A live attenuated oral vaccine was associated with mild adverse effects in general, with fever being the most common. It was not associated with increased risk of vomiting and other gastrointestinal symptoms. The risk for headache and rash were inconclusive between the V polysaccharide and the placebo arm. No direct studies have evaluated the VTT in healthy adults. A randomized controlled trial tested the VTT conjugate in children 6 months to 12 years old, showed its ability to reduce the incidence of laboratory-confirmed typhoid fever. This effect is very uncertain, especially for adults, due to the high risk of bias, imprecision from wide confidence intervals, and indirectness of the study since it used children as the study population. No randomized controlled studies have evaluated the efficacy of typhoid vaccine specifically in healthcare workers. Very low certainty evidence suggests the typhoid vaccine may not sufficiently provide protection of healthcare workers from the disease. No local cost-effectiveness study on typhoid vaccines have been published. International studies focus on low and middle-income countries where scope is limited to children. Recommendations on cost-effectiveness depend on the typhoid burden, cost of treating the typhoid fever, and price of typhoid vaccination. In the Philippines, it's usually around 2,000 pesos. No international and local studies were done for equity, acceptability, and feasibility. WHO, Australian Immunization Handbook, and ACIP recommend typhoid vaccine for healthy adults and healthcare workers within endemic countries. PISMID also recommends typhoid vaccine for healthy adults but does not recommend the routine use of vaccine for healthy healthcare workers. Recommendations: among healthy adults, we suggest the use of V-polysaccharide intramuscular vaccine for typhoid vaccination. Among healthy adults, it is insufficient to recommend for or against VTT intramuscular vaccines for typhoid vaccination. Among healthcare workers, we suggest against the routine use of typhoid vaccine. In summary, the use of typhoid vaccine is recommended for healthy adults, but it is not recommended for routine use for healthy healthcare workers. Both typhoid vaccines protect 50 to 80% of recipients. Travelers should be aware that typhoid immunization is not 100% effective and typhoid fever could still occur. Primary vaccination with oral Ty21A vaccine consists of 4 capsules, one taken every 48 hours, and should be completed more than 1 week before exposure. A booster vaccination is recommended every 5 years for those who remain at risk. Typhim B or capsular polysaccharide vaccine consists of a 0.25 mg or 0.5 ml dose administered intramuscularly. It should be given more than 2 weeks before travel. A booster vaccination is necessary for those who remain at risk. Live attenuated Ty21 vaccine should not be given to pregnant women or immunocompromised travelers, including those infected with HIV. Typhoid vaccine, particularly the oral Ty21A vaccine, should not be administered together with yellow fever vaccine because it decreases the immunogenicity of the Ty21A vaccine. It is also advised to avoid intake of any antibiotic within 72 hours of the last dose of the Ty21A vaccine. The reason behind this is that the growth of the live Ty21A strain is inhibited in vitro by the antibacterial agent. These are our references. Thank you for your attention.